Hello, everyone. Welcome to another episode of Shrinks Chat. I'm Monica Burton.
I'm Annette Ryder, and today we are meeting with a favorite guest of ours, Dr. Harold Shinitzky. Welcome back, Harold. We're so happy to be able to talk with you today on Mental Health Month and what it's like to be a therapist.
Thank you for inviting me. Always a pleasure to get together with both of you.
Yes, we love having you on the show.
I'm excited for this topic today. This is key and important for our colleagues.
Yes. So May is Mental Health Awareness Month for our listeners who aren't aware. So we wanted to talk to you today about mental health, self-care, for people in general, but also for us therapists.
Mm-hmm. Well, and also we were talking before we got on a little bit of how this is we're coming out of the pandemic and, we're creating new normals, and that's different. Our practices are different than they've probably ever been. I'm not sure they're going back to anything, first of all, I've never did this before the pandemic, record and do Zoom meetings with anyone. So there's number one for me. You too, Harold, huh?
This has become the norm. This opened up a lot of interesting opportunities for individuals who couldn't avail themselves because of distance, because of access. And so we actually have a greater spread now, a range of being able to provide mental health or medical services by our colleagues to individuals at greater distances. So there have been pros and cons on both sides of it.
Mm-hmm. Yeah. There's some good things about what's changed. And then there's also some tough change. I mean, for sure, one of the things that's been hard in my practice, and I'm sure for both of you too, and maybe all practices, is just the sheer number and volume of clients needing services, and there just not being the availability of enough therapists out there to meet those needs.
That is an unfortunate fact and reality. We saw some of that a little bit beforehand. We certainly knew it in psychiatry that there was not enough providers for those in need. And so there was a lot of people shifting to their general practitioners, their PCPs for medication maintenance and pharmacological interventions. But we have now seen that also with mental health workers, that individuals who want the needs are having a very difficult time being able to find individuals, social workers, family marital therapists, psychologists, any of us. Our schedules are very, very full. So our waiting lists have taken kind of an extension. So it is revealing that in our profession, we need to be kind of encouraging the development of more and more providers to be trained in the advanced field to be able to provide the services for those people in need.
Mm-hmm. Well, and also some caution, because as much as, I remember in October of 2019, I said, I never want to do that online stuff. And then we all know what happened in March of 2020. While I appreciate having more access across the whole state of Florida, I also hear horror stories of these larger companies that offer online only, even with psychiatry, online only, that have really created some more like-harm than help. So, I think there is a fine line of, while we do need more providers, we need good providers, and not just the kind of the run-of-the-mill, generic, does that make any sense? Are you guys hearing the same thing about some of these bigger companies?
I think the factors for determining your decision on who and how to select a provider is rather important.
Mm-hmm.
I would tend to say, the last I checked for my own practice, I believe it was 86% of my caseload has been referred by somebody else on my caseload. Mm-hmm. So I'm being vetted by my patients to other people who are asking them, hey, who would you go see? I have these personal issues. I would imagine that there are some people who, as you're pointing out, they may be looking at it as how much money can I afford? What's getting the greatest advertisement on media, social media, and TV? Oh, that must be something of credit. To understand kind of credentialing, so the vast populace in the public who are interested in seeking any mental health service, doing some really good background research on the providers is wonderfully important. Where did they get their degree? Where did they do their training? What's their specialty? Is there any opportunity of talking to people who have worked with them? Finding out a referral from a trusted friend, vitally important. And when you meet, the connection is vitally important also. And so I think there's a lot of factors. If someone comes to me with a specialty need that is not my specialty, I feel very comfortable referring them to someone I respect. And I will tell that to people who reach out to me, that that's not my specialty, but I can go through even your insurance list. Give me a list of the providers within a specific geographic range. I'll go through that list and identify at least people I personally, professionally know that I can make some recommendations. You can reach out to them. I think that's really helpful for the general public to hear that kind of logic rather than just saying who's the least expensive and who is the largest advertising pool.
Right. I agree.
Right. I think we covered this in our very first episode too, on how to pick a therapist or a counselor or a psychologist. And we tried to talk through some of those building blocks that you just kind of eloquently put there, Harold. I think it can be difficult, but I'm definitely having the same problem Monica is having, that I'm seeing people after maybe 3 months or a year of doing virtual therapy through some type of group practice. And, I even caution people to be careful about Google reviews. Like, some people have found ways to buy those. I don't really know enough about this virtual marketing scheme out there. But, I tell people, like, you really want to look at reviews on a more credible site like Health Grades. Do they have strong reviews that get reviewed? Do the reviews get reviewed? So they're not just, computer bots saying, or somebody, I spend $700 and I can get myself a great a bunch of Google reviews. That's not that difficult to manage if you can afford it. And so not really a good indicator. I've also found that I'm really struggling with, I've always run a very small private practice, and I return my own calls. I book my own appointments. Even though I have an assistant, they don't handle any upfront work like that. They don't really do direct client contact. Sometimes I'm returning emails and calls, which I used to do for 20 some years within 24 hours. I'm not even getting back to it for 2 weeks. The numbers are that high. And then the problem is, people want me to respond quicker, but if I respond quicker, the rate that they're paying has to go up accordingly, because that means I have to hire someone to do that. And that's an hourly job that I have to now factor into my business model, which helps keep my rate low. And it's that constant conflict of, I have to charge more to respond quicker at this point, because the sheer number of emails and phone calls I'm getting is really hard. So what does sometimes happen is squeaky wheels get my attention first, because they'll be like, so-and-so referred me and this doctor referred me. But, most of my clients, like you, Harold, are referred from previous clients or doctors in the areas that know me or know that this is my specialty. I'm also being a little bit more discerning, Monica, and I think you and I've talked about this with my couples that I see. I'm really asking them to figure out, no matter where they live in the state, to see me in person at least once or twice. Make a trip to St. Pete, because I just can guarantee you, for the couple dynamic, for me to read that right, I need you both in a room for a few hours, or I'm really never going to get you, and I'm going to miss a few things. And I just can't do it. I can't find that couple dynamic on a screen in your face.
I have, similar to yourself. I answer my phone calls. They come right there. We were all taught that when it comes to kind of the clinical stuff, if someone was to call an answering service, the answering service doesn't know clinical information. And so they go down a checklist. Then that answering service reaches out to me, gives me what they believe is the checklist that I had provided as far as information, without any more depth. Then I have to call the patient back. So we were always taught, just call me directly and, you leave a message and I'll get back to you. I spend a pretty significant amount of time with people on the phone when they first call and we're just kind of getting to know each other. And I'm just gathering information, whether I'm going to work with them or not. My sessions, we always talk about it. We don't stop on the hour, we stop on the issue. So last night I had a 7 p.m. session that went till 9:30. And, it's because it was an important topic that was going over, and I'm glad that we were able to do it. It happened to be a patient that I had worked with years ago, and he and his family decided to come on in, and it was very dynamic, and there were a lot of issues. But that can be time consuming. And for our topic today, it kind of feeds into that healthcare self-care for the providers. Looks like I'm getting really bright from the light over here. So
you're okay.
I'm illuminated. But it kind of dovetails into our subject matter that we're focusing on today, that, how do we healthcare providers make sure that we take care of ourselves in order to be able to then care for others? And as you're saying, our time is very full. And so we need to make sure that we're paying attention to our own mental health, spiritual, social, nutritional, all of that has to be taken into consideration. So I'm excited for the topic today.
Yeah, the intensity of the work too has gone up. So I do think this is an important topic, and I know that I've had to take a little extra time, take a vacation that maybe I normally wouldn't have taken, because it's like, okay, I can feel the compassion fatigue. So now it's time to take a vacation. So I think part of it too, as a mental health practitioner, it's giving yourself permission to take a break and to know that you actually will be a better service to your clients when you do.
I always like to say to the individuals that I supervise that no one is a bottomless pit of giving.
Right.
You have to recharge your battery. If you don't take care of yourself, you won't be able to care for others. And there's so many signs of burnout and fatigue that we're hopefully going to be, diving into and covering. And then there's the whole side about, how do we address it from an intervention? And then how do you make sure you stay maintaining in a preventive way?
Well, let's jump into that, Harold. Let's talk about some signs of burnout or compassion fatigue.
Sweet. Well, certainly we've gone through the pandemic, and first liners were the ones that we heard this about. I mean, they were providing the treatment while everybody else was sequestered or locked away. And so there was just this unending demand on one's time. There wasn't an opportunity to recharge our batteries. What we oftentimes see, from burnout and kind of issues like that, we had a great colleague of mine at Hopkins, Richard Kilbert, who wrote the book on stress and burnout, and to work with individuals who are either hospital-based or private practice and clinics, that there is this tendency for individuals to start having this kind of almost irritability, frustration that takes place. There's a kind of a negative that flows over rather than coming in with an optimism, positivism, being productive. There is a frustration, and a lot of it has to do with physiologically and cognitive overwhelmed. I don't recharge my batteries. So if I don't have the ability to do that, I actually heard of so many people talk about it, how they've become clock watchers. So if as a provider, you find yourself monitoring that clock, that's oftentimes a early sign of fatigue that's going on. If you happen to have a cancellation and you're finding yourself feeling a sense of relief or joy or kind of some type of positivity, it may be a precluding sign that you are on the direction of burnout, that your system is literally saying you need to start addressing this. And if you don't address it, well, then you start getting your own kind of medical issues. And so we see individuals, they themselves having issues with sleep, And if you don't have good sleep, you don't recover. You don't have the reproductive kind of capacity of your health, growth hormone, and all the rejuvenating factors of sleep that provides so you can be healthy for the next day, full REM capabilities. You start having interference on that. And if you start doing that, you're causing yourself harm for subsequent days. You end up having a rebound effect with lack of sleep. So the next day I'm more tired. I can't concentrate. I can't attend as well. My memory starts being affected. Word finding skills, the ability to empathize, all start to dissipate. And these are vitally important signs, not only that I'm moving into compassion fatigue and burnout, but also that I'm having my own issues. So as we say to our patients, it's one thing to have emotions. It's another thing when they become medical conditions. And so for ourselves to be aware that if we're experiencing our own levels of heightened anxiety or depression, and we know from the pandemic that mental health frontline workers reported significant drops in anxiety and depression. So we know it exists. We need to be vigilant that we're starting to have those. And so you can actually see some of these signs. And I'm sure you guys have seen these signs with some of the people that you supervise and work with.
Definitely. Absolutely. And even with myself, I've had to be more rigid with my health care than I've ever been. I feel like I'm almost parenting myself like I'm a kindergarten. Like I got to have my snacks. I mean, I'm sitting here, I'm making sure I have enough water. I'm timing out bathroom breaks. I'm making sure I have the appropriate amount of protein to get me through my day because I don't want to have the burnout. And it's, it's very clear that my boundaries are real rigid. And when I do lose a night's sleep, then I'm looking to the next day of, okay, I'm over 50. So women over 50 often lose a night's sleep. It happens pretty regularly. That's not just a sign of burnout. It's also a sign of my age. But I have to really be careful the next day to self-care and get out and maybe take a walk with my cup of coffee and get some fresh air during the day and think about what I need. And I am pretty rigid on the weekends with I need a day off. There's many days that I didn't used to do this way, but I will spend a whole day in my pajamas really having a net day. And it's how to watch that and how to take care of that. And it's hard to keep the schedule that we're doing and not let burnout take over.
I like that you're saying that you give yourself a schedule. During the lockdown period, during the pandemic, and doing a lot of work, and you could be at home, what I found that I was doing was at the end of a session, as if I was at my office, I would walk through my home. And it was a moment of kind of depressurizing. It was an opportunity to get the blood flowing again, possibly, just kind of change my focus and my perception. I would step outside, get some vitamin D, just kind of experience kind of the aspect that if I was at the office where I would walk out to the waiting room, I would sit and greet people, take a bathroom break, get a drink of water, whatever it might be. So I was giving myself that same. And here at the office, as I was sharing with Monica before we started, one of the things, once I've gotten back into the face-to-face, since I do an awful lot of work with young adults, young adult males have a lot of energy. And so the sitting in the office is kind of the traditional adult model. So I'll do a lot of walk and talk. So I'll just stroll the neighborhood, down here in the downtown St. Pete waterfront community. And it is a wonderful opportunity that is vitally important, not only to establish the relationship with these young adults so they can feel comfortable and share, but also just for personal benefit to allow me to be professionally on my game. It is exercising through the day. It's light work. It's getting, fresh air, sunlight. All of those are important. So having a structure, making sure that you are getting hydrated properly. As we're talking about sleep, very important. Got to be careful about alcohol intake. Too many people use alcohol to go to sleep, but the research shows that doesn't allow for full rest.
Right.
proper nutrition. During the pandemic, we made sure that all the athletes I was working with, we wanted to create healthy nutritional habits. We knew what they've been when we weren't in the pandemic. So during this, and we want to continue that moving forward. So being able to nutritionally take care of it, socially, being able to be connected to other individuals, because isolation is a sign oftentimes of depression. Isolation oftentimes is I'm overwhelmed. And so there's nothing wrong with choosing to do nothing when there are options. It's another thing when that's all I'm doing. And so being able to address this in a healthy way, vitally important.
Mm-hmm.
Do you all have activities and hobbies that you enjoy doing?
Yes.
Well, let's take a quick break, and then I want to hear all about Monica's hobbies and activities. As a mother of two boys, she's got a lot.
Welcome back, everyone, to another episode of Shrink Chats. I'm Monica Burton, along with Annette Ryder, and our guest today, Dr. Harold Shinitzky. Again, thanks for being here. We're talking about mental health for therapists, and we've really been talking about signs of burnout, and kind of we're going to transition into what we can do to kind of help us if we've felt like we're kind of starting down that path or we are in that path. So, but prior to the break, Harold, you were talking about hobbies. So, yeah, I mean, I do have hobbies. It's hard because I think because I do have two boys, I mean, Annette said it, they keep me busy. And that's the thing. It's like you just want to be a mom, but you also can't forget about yourself either, So I think it is finding the time. And I really enjoy what my kids are doing. So I think that's helpful. But taking some time out for myself, going to the beach, exercise. I love to cook, just finding those things that fuel me, I think are helpful.
Mm-hmm. Yeah. Monica's always got some good recipes that she'll sometimes share with me in a text message, and I enjoy that too. Yeah, I garden, and sometimes I garden well, and sometimes I don't garden so well. But if I can get my hands in the dirt a couple times a week, it does help me stay steady. I used to garden pretty seriously when I had a young child at home. We had a pretty big garden. But I've moved to a more smaller garden, and I kind of like an herb garden. And sometimes I grow a few things like some peppers or cucumbers or tomatoes, but not a whole bunch like we've done in the past. But it does help.
Yeah.
Right.
For me, tennis, bike riding, love just kind of going for a while. I used to do portraits as kind of a thing for my own self-care. And I'm going to begin actually starting to play the piano.
Oh, cool.
Just because these activities are rewarding for each one of us, as you're saying, and to be involved with things that are personally gratifying, that then leads to the next thing. It's not only participating in, but also developing an attitude of gratitude, being able to look at the world with gratefulness. And so I always try to encourage individuals therapeutically to practice that. And so, I mean, if you're structured with it, you look back, what's one thing I was grateful for in my childhood? What's one thing I was grateful for in my youth? And what's one thing I'm grateful for as an adult? And the more you practice that becomes kind of a neural pathway in the brain where I start looking at the world from a positive point of view. And really that's altering the perception of my life, which then changes the way I talk to myself, my self-talk, and it affects my behavior. So being able to not only actively be involved with things, but practice gratitude and being able to see those things both historically and presently.
Yeah, I got on Audible. I've never done that before, listening to books on tapes, but I did that during the pandemic. And I have found that it feels like this very decadent little treat to myself that I'll, even walking into the office, be listening to my book. I'm just about to finish this 10-book series. I'm on the last book, and I have found myself even resistant to listen to it because I don't want it to end. I don't want it to stop. But I also listened to probably another 20 books on tape during the pandemic too. But I really do enjoy. They're kind of escape novels, historical fiction novels that bring me back to other times, other places in the world. I find myself looking up hotels in other countries that they refer to in it, and it's kind of a little hobby that I allow myself to kind of disappear mentally and almost like take a little vacation with it. And even just getting 10 minutes to listen to the book on tape as I walk into the office or as I drive to work and stuff, it feels very decadent and a great little treat for Annette. And I treat it as such. Again, probably in that spirit of attitude of gratitude. I maybe make it bigger than it might appear to others, but it's super, super cool for me to take that little time out for me.
It is lovely to hear that when we talk about the consequences of burnout, whether it's anxiety or depression, individuals, if we ask Americans, how many of you have something that you're chronically worried about, we will find out usually it's about 33% of Americans who just report, I got stuff that I'm chronically worried about. So obviously that can interfere with my productivity during the day, because if I'm not taking care of what I need to take care of because I'm focusing on something else over here, not only am I expending energy on something I really can't do anything about right now, but I'm now not giving full attention right now here. So I'm multitasking and I'm being efficient, but I'm really not being effective. And in life, you always want to be effective before efficient. So how do I get myself to be in this moment? And as you were just pointing out, it's this decadence. It's this opportunity to be focusing on something different. It's something that's rewarding. It's something pleasurable. If you're burnt out and you have anxiety, oftentimes the concomitant effects are not just like the medical on it, but we also can't function as much. We have a tendency of focusing externally. It's worried on things. And so we oftentimes talk about there are 3 ways to waste your energy. And they're the 3 W's, which is wishing, worrying, and whining. Wishing the past was different. Well, I can't change it. So if I dwell on it, I get stuck, and dwelling on the past usually leads to depression. If I worry about the future, which I don't control, but if I get consumed and I start what ifing and I start I spend time trying to figure out every possible permutation. Well, if 1 out of 100 of those comes true, I literally wasted 99% of my time. Right. And so since I can't control the future, the only thing I ever do is increase my probability of success. So again, I got to focus here to get there. It's the process, not the outcome. And then the third one is whining about things outside of my control. If I expend my energy on that, I'm going to be more distraught. So healthcare providers who are overwhelmed at work tend to get into those, and they have a hard time letting them go. So anything we can do that gives us a break from our work, let alone, not only does it affect sleep, but it causes greater propensity for headaches, cardiovascular issues, gastrointestinal issues, all of which, again, as we were talking about earlier, it's one thing to have an emotional issue. I'm stressed, I'm distraught, I'm frustrated, I'm anxious, I'm depressed. It's another thing to start getting medical consequences because of those. So giving yourself the opportunity to have some grace, participate in activities that are rewarding to you, being able to alter your perception, all of these things are important so we can not only have health care for ourselves, but then we can also be a better provider to our patients.
Mm-hmm. Yeah, I mean, I think for me, some of what I've really gotten better at during this pandemic is focusing on the smaller things that really I find little nuggets of joy in, and allowing those to actually not be the small things, allowing them to be what they really are, which are the big things. I moved practices, I moved my location, and I'm near a grocery store now, literally 1 block from a grocery store. And on Wednesday, this grocery store has $5 sushi, and anybody who knows me knows I love sushi. And I kind of make it a thing. I pack up on Wednesday and walk over. I put my book on tape in my ear. I don't talk to anybody. I just listen to my book, and I get my sushi, and I make it a little special treat, a little special, luncheon for Annette. And I just find a lot of joy and pleasure in this very simple thing, and it makes me smile and get comfortable. And I can come back and see 4 more clients after that little venture and feel very comfortable about it and get myself set up for the rest of my afternoon.
Mm-hmm.
So it's kind of my little Wednesday hump day treat, during the week. I kind of make it through the middle of the week with a little treat for Annette.
Mm-hmm.
A little earlier, you were both talking about what you do in your own personal lives. And Monica, you were saying you've got your 2 kids that, you enjoy doing things with.
Mm-hmm.
And again, burnout oftentimes decreases our resiliency. And we don't have a healthy amount of resiliency, we can start having a shorter fuse and being more irritable. And in therapy, we oftentimes come across parents who you can actually hear them talk about their own family in a very different term. I mean, there's irritability, there's short fuse, there's a greater temper that go on, there's more reactive style versus being able to be nurturing and loving during these times. And so understanding how that affects us is if I'm a clinician, I may be less compassionate. If I'm a clinician that's burnt out, I may be more irritable.
Mm-hmm.
I may actually start spilling over my own issues into the session where I may be personalizing too many things. I might be divulging things that are not necessarily applicable to the individual I'm working with. And so again, our healthcare as providers, in order to provide good healthcare, is important. And so I think the topic we're covering today is important, that understanding these symptoms, being able to address them, hydration, proper sleep, being able to have social support networks, doing things that you can be grateful for, making sure you have the proper nutrition, giving yourself an opportunity to take a break from where you're at, having some structure that you can kind of provide rather than being just consumed with this.
Mm-hmm.
All of these vitally important for intervention, but also as we go forward, I certainly hope all of the listeners that are providers that take in your show do it on a prevention point of view. It'll help them flourish moving forward.
Mm-hmm.
These small things that I gather joy from, when I'm feeling down, when something's wrong, when it's not going well, they're also my go-to popcorn recovery modes where I go, Annette, why don't you go get yourself some sushi? Annette, why don't you let's start a new book? Annette, why don't you? And sometimes when I do that, that triggers like, oh yeah, this feels good again. And then sometimes it doesn't, Monica and Harold. And so that's a sign for me that I got to slow down a moment and take a breather. Like, wait a second, the sushi didn't work. The book didn't work. What's going on? Am I burnt out? Do I have a health problem? A few weeks back, this happened to me. And I realized I was kind of having an untreated allergy problem that I had actually thought was a weird physical symptom. I even called a doctor. I'm like, what is going on? Like, nothing that normally brings me joy. And it didn't feel like the classic burnout. But so those are also these tools and these tricks that we use, or good behavioral things. When they don't work, they're also a sign to stop and notice and check in with yourself. And it really was, I was on a medicine that's not good for my system. I took myself off of it in 48 hours. When I detoxed, I started feeling wonderful again. And, I had energy again. But these are also the signs that let me know, whoa, let's check this out and let's see what's going on when they don't bring me joy.
Yeah, I think part of what you're saying, and Harold, this even goes back to the 3 W's, which I really like. One is we know the impact of stress on our physical and emotional body makes everything go kind of haywire. But what you're both also talking about is being present, like slowing down. Like, I even have to tell myself this too when I'm in a hurry, go, 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 go. It's like, wait a minute, slow down and be attuned to what's really going on. And, a lot of people, I think, have a harder, myself included at times, have a hard time saying, okay, wait, I need to be present. I need to pay attention. Annette, noticing that you're normal, quote unquote, coping mechanisms are not working. Noticing it's like, okay, Harold, the 3 Ws, what's in my control?
Mhm.
What do I know to be true? What's happening more in the moment? I think those are important pieces that as healthcare providers, we tend to talk a lot about, but sometimes we get so like kind of involved and we're really trying to help other people that we do have to say, well, wait a minute, let's slow down, let me reconnect with myself, let me be present. Meditation, prayer, going outside and getting that vitamin D, taking deep belly breaths are a way to really help us kind of get more in the moment.
I love what you're saying, that I think there's been enough people of significance in society who have come forward and advocated to address mental health issues.
Mm-hmm.
Historically, there was a stigma associated with it, and I believe that has shifted significantly. There are still people who may judge it negatively, but I think, and especially, I work with athletes, and the number of them that have come forth, I believe that they're good role models. And so I actually find it a sign of strength when you admit you're struggling. I think covering up old school is a good way to lead to an early grave. Without insight, there is no behavioral change. And so the phrase of, if you need help, seek help, is something that would be super helpful for any of the listening audience, that they're hearing all of these symptoms that we're talking about. They're hearing the interventions, and for themselves, if they find that they're identifying with any of these, and it's starting to cause them to have struggles in their interpersonal life, in their vocational life, if they're struggling at their capacity to be functionally productive, it's not a sign of weakness. It's a sign of strength to be able to say, I need to address this. If your gas gauge is getting low, just covering it with masking tape doesn't make the problem go away. You still have that little ding. And then at nighttime, the light illuminates around it and you still get that ding. And so you take a hammer and you smash the bulb. It doesn't solve the problem.
And then you're getting out trying to push your car to go where you need to go.
You have a giant paperweight now in the middle of the street. The reality is, without insight, there is no behavioral change. To acknowledge that there's something that needs to be addressed is a superly, I think, important and strong statement about you, that you have the capacity to admit you're not impervious. Nobody is. And so that phrase of, if you need help, seek help.
Yeah, I really like that you're saying that. And I think our last interview with you, we kind of talked about mental health and athletes, because we had talked about the Olympics.
Yes.
But I found it to be interesting. My older son, who's in football, he's been invited to some football camps, and there's one organization that, while they are offering football camps, they also offer a mindset camp, which, as I read the description, a lot of it was, it written very well. But because I do what I do, I could also tell, this is about addressing mental health and, peak performance, right? In athletics, but how to help your mind. And I was like,
good.
Oh, geez, I like that one. So I think, we are normalizing mental health and getting help, which I think is really good. Even amongst us as practitioners, being able to say, like, it's okay for us to go to therapy too, and I think that that's one of the groups that have a harder time admitting that they go to therapy, or see a mindset coach, or however you want to say it.
Right.
We do, a lot of practitioners work in what are called silos. And so we have our own practice, and all day long we see our patients, and we're not interacting necessarily with others. In a group practice, you have a lot of collegial opportunities. At the School of Medicine, you're in not only those relationships, but also training and education. And you're right. I think a lot of the solo practitioners could benefit from that. How do I turn to colleagues? Where do I get my support? And if I need to be able to get some assistance myself, to be able to move forth on that.
Right.
Mm-hmm. Well, and I think what's so important as therapists, and I'm also a supervisor, and I was just actually talking to a couple supervisees before I came on to do this podcast. We were doing our weekly supervision, and we were talking about the parallel process of how we're modeling. We're not just doing the tools and techniques, we're actually modeling the tools and techniques. And there's often a parallel process going on. And I think that's what we're talking about a little bit here too, is our own parallel process and using our own tools to identify when it's time to take a pause, to take good care of ourselves, to watch out, to take a break and have some insight into ourselves. You know, I have this little weird questioning thing I do with Annette on her way to work every day. I kind of ask herself in the car, who is Annette and what does she want? Who is Annette and what does she want? Who is Annette and what does she want? And it's to help me try to break through my own blind spots of understanding myself. Because I feel like so often I'm just, okay, Annette's about to become a therapist. Annette just left the job of being a wife. Oh, she's going to wait. The kid's calling. Adult child's calling. Better talk to a mom. Oh, my mom's calling. Better be adult daughter, right? Like I have all the roles, all those hats, and I'm good at all of them. But I also am still Annette under all of those roles. There's still a me. And I have to find her every day and honor her and be her in some small way, or I lose her. And then I can't be any of those roles. And it's a challenge to manage all of that. And certainly the challenge just changes in life. We all have our different responsibility, whether you're married or not married, kids or not kids. You have people you love that you're checking in with, that's checking in with you. You have your jobs, you've got stuff going on, and it's maybe a busier time than ever. And mental health therapists are not immune to this. You know, we're not immune to this, and we have to face this. And you know, overall, my clients, when I say, hey, I'm going to take a couple of days off, they're all like, oh, I hope you have a good time. I hope you relax. You don't need to tell me what you're doing. And so overall, you know, my clients aren't like work harder, work more. You know, I don't have that going on.
Yeah, the time and commitment that we all give, and it's interesting that you're talking about that. For the individuals that I work with, they know that on an annual basis, I do a bucket list trip with my father. I'm grateful he's alive and he's healthy enough to do these things. And we will go on adventures around the world. And the individuals I work with are grateful the amount of time and effort I give for them. And it's never a negative. It is a statement on their part that they're grateful that I'm role modeling, that, you know, I have healthcare that's important, that I value relationship with family, and that I'm willing to spend time with, and that this self-care will actually prove to be beneficial. So it's not selfish. And I always want to emphasize this to individuals. If you're making decisions that are based on your best interest, that's not selfish, that's self-interest. Mm-hmm. And if you're making it that it's going to be your healthcare, I always say the two most important factors for decision-making are health and family. If you're making a decision based on health and family, that is not selfish, that's self-interest. And if somebody else says that's being selfish, stop for a moment and realize they're being selfish. Mm-hmm. If someone is calling you selfish for making a decision based on health and family, you're not being selfish. Mm-hmm. It's self-interest. And the other person actually is. So what we're talking about here is self-interest, that you have worth and value. And the best way to be able to do that is be cognizant of how you're doing mentally, physically, spiritually, socially. And when there is that fluctuation that takes place, I'm not able to concentrate as well. My memory is affected. My attentiveness is, Monica, as you were saying, I can't be present at this point. If I'm stuck in my head, if I'm starting to kind of be irritable and annoyed, you know, if I'm a clock watcher, all of these are signs that let us know we have to be taking care of ourselves. And that's what we're talking about today. I think is important for any of our colleagues to be spending the time investing in themselves.
Mm-hmm. Well, that's a perfect wrap up and ending there. I couldn't have done it better myself. Nice job.
Yes, thank you, Harold.
Always a pleasure to
Health
get
and
together with
family.
you.
Mhm.
Health and family. I'm not forgetting that. Health and family. Those are good points to focus on.
Yeah. And the
Well, thank you for the invitation. It's an important topic. And I hope the listeners, not only those who are providers, get a lot out of it, but I also want just the listeners in general. The same stuff we're talking about applies to them if they are stressed out.
Mm-hmm. Yes. Burnout doesn't just apply to mental health or healthcare workers. It applies to everybody.
Mm-hmm. Right. And I hope this shows that we're normal people too. Thank you so much for being with us. Please follow us on Facebook, like us, ask questions. We'll get back to you. Also on Instagram. We can't thank you enough, Harold.
As always, it's a pleasure. Thank you all.